Good morning, everyone. All this week, public health organizations across the country are celebrating National Public Health Week. This year's theme is Raising the Grade. As you can see here, we have also given ourselves a report card here at Jefferson County with a small sample of key health indicators. We're also inviting the public to open houses at all 4 of our health centers, as well as public health partners. At each of the open houses, individuals will get a chance to tour our facilities, get a glimpse of the work we do, and also have an opportunity to give themselves a personal health report card. I'm not going to go over every detail of our report card today, but I'd like to give you an overview of where we have been in Jefferson County, what we have accomplished through public health efforts, and then talk about some of the biggest challenges we face today. This is the Jefferson County Department of Health's 98th year. It was established in 1917 in response to a number of public health crises. There were 844 cases of typhoid fever in Jefferson County that year, with 81 deaths out of a population of about 300,000 people at that time. Tuberculosis was also a serious health threat in 1917, with an annual death rate of 220 per 1,000 population. The infant mortality rate was 148 deaths per 1,000 live births. In other words, about 15% of babies born alive did not survive past their first birthday. Epidemics of other diseases, including diphtheria, poliomyelitis, smallpox, plagued the first half of that century, claiming the lives of thousands and leaving others permanently crippled or scarred. The influenza pandemic of 1918 and 1919 resulted in over 12,000 deaths in Jefferson County alone. From 1923 to 1926, over 4,000 people in Jefferson County died of smallpox. In 1929, influenza struck again, killing over 11,000 people in the county. Foodborne illnesses were also well known in our county at that time. Approximately 400 people in Jefferson County died of food poisoning in 1922. The environment in Jefferson County was, of course, quite different from the way it is now. Thousands of homes had been built without indoor bathrooms. Garbage was dumped indiscriminately. There were homes surrounded by animal yards where livestock roamed at will. Garbage, animal feed, and animal droppings attracted rats, roaches, flies, and other pests, which aided in the spread of numerous diseases to humans. There are accounts written during that time that referred to our community as a pest hole. One particularly interesting story has to do with the high rate of typhoid fever during that time. Also, a death rate from diarrheal illnesses, mostly young children, that was 183 per 100,000 population during 1917, the year that Jefferson County Department of Health was established. It was determined that typhoid and much of the diarrheal illnesses were linked to the local milk supply. Dr. Judson Dowling, the first full-time countywide health officer, led the effort to address the problem. By 1920, Dr. Dowling had persuaded the Birmingham city government to adopt an ordinance prohibiting the sale of milk with bacteria count above a certain level, essentially requiring pasteurization. The law also provided for regular inspections of dairies and prohibited sale of milk from dairies that did not pass inspection. The dairy operators fought back. Dr. Dowling was kidnapped from his home, taken to a remote area where he was flogged and given an ultimatum to get out of town in 30 days. This act outraged the community, which was beginning to experience the benefits of the work of Dr. Dowling and the new health department. The public and local governments rallied with enthusiastic support for Dr. Dowling's efforts. He went on to serve as health officer for 20 more years, and the value of our health department has never again been in doubt. Another great success story is the control of tuberculosis, which killed thousands early in the last century and required isolation of thousands more. It's been addressed through medications and through public health surveillance programs. In 2014, there were only 19 cases of active TB in Jefferson County. The number of cases has remained fairly stable in the past several years. We continue to work hard to keep this disease under control and to minimize the risk of multi-drug resistant TB, which is a huge problem in much of the world. Through our directly observed treatment program and through new technology, which allows us to identify drug resistance patterns early. We've come a long way in Jefferson County, and we have a lot to celebrate. Much of what we do in public health today, much of our workforce that's here with me today, is to assure that we maintain the gains that we have made. If our public health system were not in place to prevent disease, we could easily lose ground on many of these fronts. Now, let's look some more at what's been going on in the past year or so. In the area of infectious diseases, we've had quite a year. Our Prevention and Epidemiology Division of Disease Control, along with members of our Food and Lodging Division of Environmental Health, investigated a significant outbreak of Legionella at a local hospital. Our country had the worst outbreak of enterovirus D68 in history, causing severe respiratory illness and sometimes neurologic deficits in children. We had 2 confirmed cases among Jefferson County residents, and there were others admitted to our children's hospital from other counties, which we helped investigate. Our epi and prevention team investigated respiratory and gastrointestinal illnesses at several daycares, schools, and long-term living facilities. They conducted 13 foodborne disease investigations at local food establishments. They also investigated over 300 confirmed cases of notifiable illnesses and conditions. Among these were 92 cases of illness from Salmonella, 45 cases from Shigella, and 23 cases of Campylobacter. Of course, the Ebola outbreak in Western Africa was a major public health crisis that led to a great deal of concern around the world and in the United States. This occupied much of our time and attention during this past year, as we took a proactive role in educating the community and making sure we were prepared in the event a case came to Jefferson County. Our team monitored several travelers from Western African countries until they completed their 21-day incubation period for Ebola virus disease. This experience has helped our community be overall better prepared for future threats from dangerous diseases, whether they are Ebola or something else. One of the greatest triumphs of public health has been the prevention of childhood diseases through immunizations. Smallpox, which at the beginning of the last century killed thousands of people in our county, has been eradicated from the earth. The world has come close to eradicating polio, although recent political and social unrest has caused some setbacks in this effort. Other diseases that are now controlled by immunizations are measles, mumps, rubella, diphtheria, tetanus, hepatitis B, Haemophilus influenza B, and chickenpox. Today's fully immunized children have little reason to fear dying young or being permanently disabled by any of these diseases. There have been recent concerns about waning immunity from pertussis vaccines, which can still endanger newborns who have not yet been vaccinated and who are exposed to people with a cough from pertussis. Therefore, we continue to urge adults to get booster vaccines for pertussis. This past year has seen some significant measles outbreaks in other parts of the United States, where high percentages of people are opting out of vaccines for their children. To me, this is totally unacceptable, and unfortunately, it illustrates the challenges we sometimes face in convincing the public to believe the science over other misleading and irresponsible voices. In Jefferson County, we can celebrate that we have an outstanding overall vaccination rate of 96% of children in public and private schools. Adults too have benefited from immunizations, in particular the influenza vaccine, which is recommended for all persons over the age of 6 months. While flu activity in Jefferson County has been quite prevalent this season, and the vaccine was unusually ineffective due to an antigenic drift that occurred, or shift that occurred during this past year, there has not been an increase in flu and flu-like illnesses compared to the previous year, accounting for just under 4% of clinic visits in the first week of December of both years. However, we must remain vigilant and remember that influenza kills, it mutates often, and can quickly become epidemic, so flu shots are needed annually. Sexually transmitted infections are still a public health concern, with many challenges. In 2014, Jefferson County reported 59 cases of primary and secondary syphilis, up from 52 cases in 2013. 73% of syphilis cases were among men having sex with men. During 2014, there were 152 newly diagnosed cases of HIV in Jefferson County, down from 175 in 2013. A breakdown of the 2013 data showed that 72% of new HIV diagnoses were among gay and bisexual men, 23% were attributed to heterosexual contact, and 3% were attributed to injection drug use. Overall, African Americans were disproportionately affected by HIV. Over 100 new restaurants open each year, and more people are purchasing at least one meal a day from a food service establishment. To help ensure that the safety of food sold for human consumption is safe, the Health Department's Food and Lodging Division made 14,871 food service facilities inspections last year. Along with these inspections, our food inspection staff investigated 1,520 complaints in 2014. They continue to regularly educate food handlers in safe food preparation. Another area where we have seen great improvement is in the area of pollution control. Our Environmental Health, Air, and Radiation Division is responsible for monitoring and regulating sources of air pollution for the EPA in Jefferson County. To go back a little in history, in November 1971, during a period of unusual air stagnation, the levels of particulate matter rose to levels that far exceeded what was considered dangerous to the health. 23 polluting industries had to be shut down for several days in order for the air to get clean enough to breathe safely again. Today, the air in Jefferson County is the cleanest it's been in many decades due to stricter regulations, a decline in the number of heavy polluting industries in the area, and cleaner running motor vehicles. We are now in attainment for all criteria pollutants under the National Ambient Air Quality Standards. I've talked a lot about areas where we've had some great successes, but today we are faced with a new set of challenges that were not of great concern a century ago. While the United States leads the world in medical technology, advanced medical interventions, and pharmaceutical development, we are now lagging behind most of the rest of the developed world in overall health outcomes. We spend almost 20% of our gross national domestic product on health care, twice as much as the next most expensive healthcare system of any country. And yet, we have one of the highest infant mortality rates and lowest life expectancies. And in a land that is supposed to be about equal opportunity, we have major disparities in health between people of different races and socioeconomic status. While it can be argued that we can get more bang for our buck through disease prevention efforts, we only invest 4% of overall health expenditures in prevention. The number one cause of death in the United States and in Alabama and here locally is heart disease. The second cause of death is cancer. Almost half of us will get cancer in our lifetime. The incidence of both these killers can be greatly reduced through prevention efforts, through lifestyle change. Number 1, avoidance of tobacco. Tobacco is still the number 1 preventable cause of death in the United States, contributing greatly to heart disease and multiple types of cancer, not just lung cancer. 20% of adults in Jefferson County report smoking. This is lower than the Alabama average and slightly higher than the national average. Unfortunately, the percentage of teenagers who still initiate smoking is still high. Number 2, salt intake is a major contributor to heart disease and hypertension, which also leads to stroke, kidney disease, and other vascular disease. Some estimates have high salt intake as contributing to almost half the number of deaths that smoking does. Obesity and diets that are low in fruits, vegetables, and whole grains also increase the risk of cancer, in addition to diabetes and its many complications. Jefferson County's adult obesity rate is 35%. About another third are overweight. Alabama is number one in the nation in the prevalence of diabetes. There's too much consumption of sugary drinks, and less than half the population is getting the recommended minimum of 150 minutes of moderate intensity exercise each week. Number 4, a public health crisis that has recently emerged is that of drug overdose deaths. Of course, drug addiction and drug abuse are not a new problem, but the types of drugs that predominate come and go over time. Right now, we are having a particularly bad time with overdose deaths from heroin and prescription painkillers or opioids. To give you a baseline perspective, there were only 12 heroin overdose deaths reported in Jefferson County in 2010. In 2012, that number went up to 58 heroin overdose deaths and 73 prescription overdose deaths. And we thought that was an alarming increase. But in 2014, it got much worse. 137 confirmed heroin deaths and 121 prescription drug deaths in 2014, plus a handful of other deaths from indirect causes such as traffic accidents under the influence. Heroin and prescription drug overdoses now exceed the rate of all other injury deaths and the rate of homicides. And finally, number 5, we've come a long way in infant mortality. Remember that 15% from a century ago? But we continue to be greatly concerned about the number of babies who die before their first birthdays. This is the infant mortality rate, defined as the number of deaths before 1 year of age for 1,000 live births. The overall infant mortality rate averaged for 2011 to 2013 in Jefferson County is 11.3 per 1,000 live births. This is higher than the Alabama average and almost twice the national average. The infant mortality is often seen as a strong summary indicator of the overall population's health, the so-called canary in the coal mine. Unfortunately, it also serves as a stark indicator of disparity in health related to race. Jefferson County's white infant mortality rate is 6.5. However, it is much higher for non-whites, 16.2. In summary, and as we look back, we're proud of the role public health has played in improving the environment and the health of our people. In the last century, the life expectancy of the average American has increased by 30 years. Most of that increase is attributed to not to advances in medical technology and medical care per se, but to public health, improved sanitation, safer work conditions, the control of infectious diseases, and other public health interventions. As we approach the beginning of our second 100 years here at the Jefferson County Department of Health, we have to maintain the gains of the past and to address these new health threats as our community and the world around us continues to change. I would argue that these new threats are more complex than some of the threats of the past. We can sometimes achieve gains through regulation and policy change, but there's a limit to how much we can change the lifestyles and health behaviors, the main drivers of public health problems, through these means. We're striving to find new and creative ways to make healthier behaviors more likely to occur in our population by default. This will require us to keep our public health department strong, but it will also require more than that. It will require all of us to work together, individual citizens, nonprofits, healthcare providers, and government at all levels, to build a healthy community of healthy people in a healthy environment. We invite you to join us in celebrating Public Health Week, and we invite you to become long-term partners in public health. Thank you.